Neck pain and disc problems. As we get into this, I'm going to give you some recent cases of people coming into me with acute onset neck pain. One is a little bit longer, and we're going to talk about how we're going to unravel that and get into some treatment protocols. I'm going to be talking about conservative options. Hopefully, many of these people will avoid surgery or long-term medications, and that's the reason for what we do. And remember now, as you're considering going to a chiropractor, physical therapy, whatever it might be, acupuncture, massage, and so forth, that if you have a serious condition that needs medical attention, get that attention, okay? If you're having sharp, searing pain down your arm and you can't sleep because the pain is so bad, go get a medical evaluation, whether it be urgent care, emergency room, and so forth, okay? Now, for the rest of us, we usually, in most cases, can handle this conservatively. Here's 3 people that are seeing me recently. One is a 29-year-old male. His neck pain has been slowly coming on over time. Now, I've worked with him in years past, and we had good resolution with problems. But recently, and with COVID and family and so forth, his neck pain started coming on again, but he didn't see me right away, and it's beginning to get worse. And now it's really becoming uncomfortable, interfering with sleep, going down an arm, and so forth. Okay, so prior to restarting at my office, he had an MRI, he has an orthopedic on board, and then he calls me, he says, you know, I want to try to avoid these other things, let's go to work. So I'll touch on that a little bit later. We're just getting started with him, and I gave him a list of things that we're going to be doing. So the next one is a 44-year-old female. She had sudden onset neck pain a month prior to coming to my office. So it wasn't getting any better, and she couldn't even move her neck. Now, she's only 44, so literally this is her range of motion, and she just started with me just a couple of visits right now. That's it. That's all she has for range of motion, okay? So her neck pain is terrible. It's worse at night, interfering sleep, and the whole thing. Now, she's in an unfortunate situation where she's in between jobs, so her medical insurance ended, so she doesn't have medical insurance right now. So she's coming to see me and paying out of pocket, but she didn't go for any medical care. Why not? Because she doesn't have any medical insurance right now, okay? So she's in here. I think we're going to be able to handle it from a conservative option. The last one was a 48-year-old female who had sudden onset of neck pain and arm pain 2 weeks prior to coming to my office, which was a month ago. So she came in, and it took a little investigative work to figure out. She said, I don't know what happened. And so I peppered her with a bunch of questions, and we dug into the history. Sure enough, she's in yoga training. She's yoga instructor training, and they're moving along, and then they moved to headstands. So she started doing headstands slowly, appropriately, gently, but as soon as that started, boom, neck and arm pain began. And that's just a reminder that all yoga, all workouts, all weight workouts and so forth, all of these exercise programs, they're all well-meaning, not pointing any fingers. We as participants are well-meaning, instructors and trainers are well-meaning, but not every exercise is good for every person. So when these people come in to see me with neck pain, the first thing I do is I try to explain what's wrong. And in almost all cases, we have a disc problem, a disc and a joint problem deep inside the neck. Now I'm showing you the model here because if you look at the size of my neck, it's got some size to it, right? But when you look at the discs and joints deep inside the spine, you have to look at how small they are. They're really small. A disc is only about yay big in diameter, and they're pretty darn thin. It's definitely smaller than a checker. You know, the discs in the lower back are maybe the size of a checker, but these are even smaller. They're really small structures, and we're asking them to do a lot. We're sticking a big bowling ball on top of them, right? And we ask them to be able to do all of this amazing range of motion and be able to handle traumas and activities and hold that bowling ball in place like this in front of computers and phones for forever, all day long, and we expect them to last 120 years, okay? So that's what's going on in here. And most people that come into me with acute pain, it's not a muscle problem. That's the first thing I just let people know. People don't call my office or a physical therapist or an orthopedic or whatever, acupuncturist, massage therapist. With ongoing neck pain, that's just a muscle problem, okay? Muscles heal quickly, they have a great blood supply. Disc problem and joint problems, particularly the folks that I told you with pain going down an arm and so forth, They ain't muscle. Now we're going to use muscles and tendons as a conduit to improve the spine, but the cause of the pain are the irritated discs and joints deep inside. Now in the case of a disc bulge or herniation, which the 29-year-old male has identified on MRI, it might press on one of the nerves that's going down the arm. Okay? Now, not all arm pain means that you have a herniated disc where the donut gets squished and the jelly comes out and sits on a nerve. Sometimes that's the case, and sometimes it's not. You can have pain down an arm or a leg and not have a disc herniation, so keep that in mind. You can still have a disc problem, but it might not be that the disc is sitting on the nerve. Follow? Okay. So the cartilage discs between the bones is usually the cause of neck pain, and the joints, the little joints back in here, and I always explain it to people, those little joints are like the joint on the end of your pinky, okay? It's a hinge joint. You've got several of them on the sides of the neck here, which allow us to move, okay? Those are the supportive structures, but they're also pain sensitive, and they become worn over time and injured. Disc problems, joint problems, that's what I explain to people. In most of the cases, that's what's going on. So we explain that. Now, how does it get that way? Well, we can have some wear and tear going on in the spine, not have any pain, and then go do one thing like headstands in yoga, or go to the gym and work out, or rake the lawn for 6 hours, or do an extra project in front of the computer for a sustained period of time. Now we have pain. But oftentimes, that injury is the straw that broke the camel's back. This has been wearing and tearing already. Okay? In the case of the 29-year-old man, I know his neck, instead of having a beautiful curve in the neck like this from prior x-rays that we took on him, here's a reverse curve in his neck. So the front end of the car is already out of alignment, and then he has a sit-down job where he's activating this even more, which adds further insult in there, and then boom, it wears down over time. So one of the analogies I always use is we think of these discs like tires on a car. If the tires and the wheels in the car are in perfect alignment and we rotate them around the car and we check the air pressures and we make sure that they're balanced, the tires are going to wear evenly on the car and you're going to get a maximum life out of those tires. Same thing with the spine. If we take care of them appropriately, if we get spinal checkups with the chiropractor, if you do your daily exercises, if you watch your positions and ergonomics and try to make changes there, you're not going to wear down those tires on the car if one of them is out of alignment and you don't catch it and keep driving, it's going to wear down. For a while, this is important, for a while the wear and tear process isn't announced, there's no pain, the car is running silky smooth down the highway, all is good, you cancel the tune-up, you cancel the front end alignment, you don't need those things because it's running so great. And then all of a sudden one day you feel the wheel shaking down the highway or it's squealing around the corner, whatever it might be. Bring it to the mechanic and they say, oh, well one of the tires is all worn down in one spot because the front end has been out of alignment for a long time. You're like, wow, I had no idea there weren't any symptoms of that as the wear and tear process goes along. So when somebody sits in front of a computer for a bunch of years and they don't have any neck pain, don't have any headaches, don't have any arm pain, no carpal tunnel, and then all of a sudden they wake up and say, my neck's starting to bother me, and they come in to see me or some other practitioner, we say, well, it's a wear and tear process that's been going on for a long time. So those are the analogies that we use. And then, well, what do we do about it? And that's the list of things that I want to talk about now, okay? So I give people a list of things to do. We don't do this all on visit number one. The first thing I talk about, what are we going to do with these acute spinal situations? So let's say that you're going to go to the chiropractor and or the physical therapist or acupuncturist, or you need to go to orthopedic because it's a more serious condition, or even massage, okay? And keep in mind sometimes, and even massage therapists know this, with a really acute problem like the couple of cases I gave you here, a massage when it's really acute might not be the best thing to do. Later on, it might be a great thing to do, okay? So just keep that in mind. So we need to address the acute pain issues that are going on. And in the case of the 29-year-old man, I know his curve is like this. It's exactly in the wrong direction. We're going to be doing things in the office and at home and with exercises to his tolerance, always going slow but steady and starting to rebuild the structure and biomechanics into the neck to take stress off the discs and the joints. Hopefully the disc will heal, come off that nerve, reduce the arm pain and so forth. So we get the treatments, number one, for the spinal conditions and the acute pain that's going on. The second thing I do is, and this is more for people in more chronic pain that's not going away in a day, a week, or a month, is you've got to clean up your diet, a clean anti-inflammatory diet. A lot of people are not told that what they eat can actually affect their inflammation. Inflammation can affect how much pain that they have. So then we get into the clean diet scenarios, and I let them know, if you've had this chronic problem in your neck or your back, these are one of the strategies to help you get out of that. Number three, particularly with the actually neck and lower back, is I give people sitting management techniques. We've talked about that on here. So if I'm doing some work in the office and they're doing some stretches in the morning and night, but then they go and sit in front of a computer for 10 hours like this all day, or they're on their phone a lot or whatever, that's going to undo or definitely slow down the progress. So we have to get into sitting management, changing the biomechanics of how we're using our body day to day. Number four, this is an important one as well. And I had to go into this with all three of these people that I'm talking about now, and thousands of times with people with acute neck and back pain. Ice, no heat. Only ice, no heat. Don't forget to use ice, and don't use any heat. So this is my ice speech that I talk about, and I have helped so many people because they're at home, particularly in the winter months when it's cold. It hurts, they put heat on it, and they say, wow, it feels better while I have the heat on it. It must be helping. I'm going to continue using heat. Unfortunately, heat increases swelling, so an hour or two later the pain is worse. They don't know why. They put heat on it again. If you put heat on it at night, I tell people it's like putting a blowtorch on a sunburn. Okay? It's going to inflame it more. 2 hours later you wake up, you're in pain, you can't fall back asleep, you're baking yourself with the heating pad. Stop. I also ask people, how many times after you see an injury on the field or whatever do they pack somebody full of heat? Right? An athlete? It never happens. It's always ice. Ice is anti-inflammatory. And then I ask a person, let's say I have a freshly sprained ankle and it's blown up like a balloon. I talk about sprained ankles all the time. Even if somebody hasn't had a sprained ankle, they can wrap their head around a sprained ankle. So I've sprained my ankle, it's swollen up like a balloon. What do I do at home? Ice or heat? Everybody says ice. There's your answer. So whether it's a swollen, inflamed, injured ankle or a swollen, inflamed, injured neck, the only difference is you can't see the swelling in the neck, but it's there because the body knows no different from sprained tissues in the ankle or an irritated disc or muscles and joints in the neck. When you ice it down, it's anti-inflammatory. When I switch people from heat to ice, good things tend to happen. And then I also tell people, make sure that you're icing at night before bed. If your neck condition, back condition, whatever it is interfering with sleep, it's nice to take out some of those inflammatory fluids and swelling, knock down the pain pathway by putting ice on it just before you go to bed. The next one is water. So remembering that all of your cells need water. If you are chronic dehydration, the body's not going to work right, it's not going to be able to heal appropriately and so forth. Make sure you're drinking enough water. Make sure you check with your doctor before you increase your water intake, particularly if you're taking medications, check with your doctor. But getting enough water in, we've done shows on that as well. Increasing hydration can really help somebody fight the inflammatory process. Number 6 is probably the most important one, probably the one that we talk about the least, is reducing stress. So I'll have people, again, more of a chronic neck pain situation, that they're coming in and their results are slow, or they'll get better for a while and get worse. And I can think of 4 or 5 cases right now. We're just coming off of vacation week in April here in 2022. And people had either physical stress from traveling and lugging luggage and kids and packages and pillows that didn't work and mattresses that didn't work and flares up their neck or back. Or it's the chronic mental, emotional, and spiritual stress. And when you have that constant drip, drip, drip of stress and inflammation and the stress chemicals, that's going to increase the pain pathways, continue the inflammation, continuing the pain situation. We've got to look at that. And again, we've talked about that many, many times on this program here. And the 7th, if we need to go there, is the anti-inflammatory supplements. Anti-inflammatory supplements, one of the biggest ones out there is omega-3 fish oil. I talked about Dr. Joseph Maroon, an orthopedic surgeon who took people with chronic pain, knocked out a good chunk of it by just increasing their omega-3s. You can also do B complex, vitamin D, and magnesium. Those are a great place to start. Always check with your doctor before you take supplements, and particularly if on medications. Definitely do not take supplements until you check with your doctor. But here's how we start to address some of the neck problems that people bring in with, including disc bulges and herniations that don't have an acute need for surgery at the time. this is how we go through the rehabilitation process. As you can see with this program, sometimes some people get well quickly, like in just a few weeks, but some people with a more chronic problem, it can be months. So just keep that in mind. But the more we dig into a program like this, I let people know, the more you dig in, typically, without promises, typically the faster your results. I'm Dr. Scott Fuller. Thank you.